much for holding with us as we just got all of us in here. We're actually 3 people from 3 different locations around the globe. So I'll just give us a quick introduction and we'll kind of share our story. So we're New York Calling. If you haven't heard of us before, simply put, we're a group of New Yorkers who have mobilized the creative community to produce PPE for healthcare workers fighting COVID-19. We started, at the onset of COVID, really like in March, April times, and we just kind of gathered together as a bunch of different designers, virtual merchandisers, art directors, and different creatives who just wanted to help. We're a core team of about 9 people. We span 3 different cities, maybe more, and 2 continents. So I'll let everyone kind of get into who they are and where they're from. But while there's just 3 of us here representing today, we did want to give credit and kind of show off the whole team that is behind this really grassroots organization that we've created in the past year. I'll kick it off. I'm Gabriella. I am kind of the creative on New York Calling. I joined pretty early on to help develop the brand identity, the visuals, how we show up in the world, a little bit of the site, although I'm not a web developer, but I tried my best, as well as the social and kind of just communications platform. In my day-to-day life, my regular life, so to speak, I'm a creative art director, and I work in the advertising space.
I'm Catherine. So I work with New York Calling on strategy. I was one of the people that started New York Calling with Dara and Heidi, and then we brought Gabriella on the team very early on. So I was raised in Queens in New York. I don't live there anymore. I live in Tunis. But when the pandemic started in New York, I was really confused by how slow the government was with procuring PPE. So me, Dara, and Heidi had a conversation, got together, started talking about what solutions we could come up with, what we could do, how we could pull our resources to make something happen. And then eventually we started New York Calling and brought a group together. So Dara, is your mic working?
It is now, sorry.
Okay, great.
I think that or something. So hi, I'm Dara. I'm from Queens, New York. I live between New York and LA. I am a visual merchandiser / spatial designer. And I mostly organize the supply chain and like the production side of things for the PPE creation. That's about it.
So we started New York Calling. It was kind of a really crazy story. I live in Tunisia, and a friend of mine in Tunis was making plexiglass boxes for the intubation process in hospitals in Tunis. So intubation is like a process that happens when somebody is experiencing symptoms of COVID-19. And then basically there were plexiglass boxes that basically keep healthcare workers safe from any sort of splashback while the patient is being treated. So a friend of mine was creating these boxes in Tunisia, and I had put a screenshot up on my stories, and then my friend Dara, whom I know from high school, had replied to me and said, I think we can maybe try to do something similar in New York. We ended up not being able to do exactly the same thing, but what she had mentioned is that there were maker spaces that would possibly be able to 3D print face shields. So when we realized that we could actually mobilize these maker spaces to 3D print face shields, we got the team together and tried to make something happen, because we realized that there were so many hospitals and healthcare facilities that were in dire need of PPE. At the beginning of the pandemic, the government had not prepared at all. So there were hospital workers, some of them were friends of ours, that ended up going into shifts completely without any PPE. They were wearing ski masks and ski goggles. So we were like, okay, let's 3D print PPE and see if we can get it out to hospitals.
So these are 2 different 3D printers that we set up in one of our vendors. So basically we ended up like partnering with, actually, so to explain the vendors, I work in retail design. So I typically will make custom fixtures or like graphics or just various retail assets. at like certain places around the cities. And so we reached out to this vendor, and they were very on board to like volunteer their supplies and machines to help fabricate the shields. So I guess like simultaneously while we were like raising money, we started testing out different frames that we were going to end up donating to hospitals. This is what a complete shield looks like. Basically just the frame, which you saw being printed on the slide before this, and then the clear plastic face cover, which we actually, funnily enough, we had a food manufacturer, which they like kind of supplied plastic face covers for us. So that's what that is. Sorry, I'm like echoing right now. It's like kind of throwing me off. I'm sorry, guys.
No, you sound great. Yeah, I think this shield took a couple different iterations for us to get to, but it was really interesting to see it come to life. Like from my background, not actually having a lot of experience in actual like product design, I'm much more like on an advertising and marketing end. It was really cool to see Dara and the team, Catherine, just like we were all together in these text threads having conversations about, oh, we should round the edges so it's more comfortable, or the plastic thickness is a little bit different now, so we have to change the way the frames are printed. You just saw all these iterations happening in real time, and I think it was just such an organic process, and we just kind of from the get-go we're just making things, trying them out, giving them to people and getting real-time feedback. And so this ended up being one of the later designs, but I think it was just a really incredible process of just putting yourself out there and trying to figure it out as you go, and not letting that hold you back from helping other people and provide provide resources.
Yeah, just to add to that also, I think something that really worked to our advantage is the fact that we had so many friends that were working in the healthcare space that actually had to wear these masks for extremely long shifts. Some shifts were like 12, 14 hours long. So getting feedback from people that actually had to wear these face shields for really, really long hours, and then understanding like where we could do a better job with product design was really helpful for us also.
Yeah. So then here on these slides, we kind of just are showing a little bit of our delivery process and kind of our packing process. It was all very organic. I'll let Dara speak to a little bit more, but again, it just was like an all hands on deck. Whatever anyone could do, they did, and they just kind of supported, and it didn't matter if you had this experience or not. I think it was just people who wanted to get together and help.
Yeah, sorry, I'm gonna try to speak over my echo. Okay, actually, I think it's gone now. Sorry.
Good.
But yeah, so basically, I like organized like a supply chain in my mom's house in Queens, and I had my sisters and just like friends from like grade school, like even ended up reconnecting with us to like help volunteer, like pack and sterilize and box and drop off these shields like across the 5 boroughs, even Connecticut, New Jersey. It kind of became this like huge operation, or like much bigger than what I think any of us had anticipated, honestly.
And then here on this slide is just kind of like we documented a lot of our process. And I think one of our strengths that we realized throughout was how much transparency we shared from beginning to end. So like all of these photos appeared on our Instagram. We really like showcased whenever we traveled somewhere, where we were going, the actual reactions. You can even see like our text message chain on the right there. Like that's the whole team on a text chain, because for so long, this whole operation really existed between phone calls and text chains, and just kind of showing how we got there, what we did, and just wanting to share this process with people, because I think it's also how we got more volunteers that were like, oh, I have a car, I can drive to Rikers, I can drive to this healthcare hospital, or I have a bike, I want to do this. And so by sharing what we were doing and how relatively simple each step was, I think it invited more people and excited them to get involved. Some little videos there. And then this slide is really all about that response, and just kind of, I think one of the biggest strengths of all of it, and I can't even take credit for this because I'm in Portland, Oregon, so I wasn't actually even in New York to do this, but Dara was like, face to face with a lot of different healthcare workers and got to really talk to them firsthand, see what they were going through, hear their stories, and feel like the gratitude and kind of like both ways, right? Like we're so grateful for these people putting themselves out there and taking care of our community and of the people within it. And then, you know, them towards us, they had some really horrific conditions. We heard about really crazy stories of, you know, unsuitable PPE that they were given or that were not, you couldn't even call it PPE. And so here we were trying to help them, and they just, you know, were so warm and grateful. And even that photo on the right, you see the guy at, I think he's from Rikers, right? And he just was like so excited to like actually have a face shield because they were reusing their products like so many times that it was no longer sanitary.
I remember around this time also there was that something that had gone viral, was there was like a New York, a nurse, I believe, in New York that was given like a New York Yankees rain poncho or something to wear as PPE. And this was around the time when we had started, I remember these photos happened around the same time that this photo went viral of like this New York Yankees rain poncho PPE. And I think also just speaking, Gabby, to like what you were saying about like us sharing our process on social, I remember that there were a lot of healthcare workers as well that were coming to us and saying like, hey, we need PPE. Are you able to get it to this hospital or that hospital? I remember at some point Dara drove upstate New York, I think 4 hours upstate New York to deliver PPE because there were healthcare workers all around the state at this point that didn't have accessible PPE, or they were reusing it for ships on ships on ships. It was a really intense moment, I think.
Yeah. And so then we're kind of going through this very casually because we want to make sure we have room for questions and everything, but we did just want to give everyone a little view at what it looked like a month in. You know, we started very organically, like you heard from the text message. We got everything together as much as we could. We, you know, gathered our friends in our different like creative community from, you know, 3 different cities, 2 continents, which is kind of crazy, and just started kind of making this happen. And so we won't spend too long on this, but I do think we want to call out like the different healthcare facilities that we were able to service. We raised a lot of money organically via Venmo and PayPal, and we'll kind of talk a little bit more about the PayPal relationship we ended up having. But the healthcare facilities that we were able to kind of connect with, like through DMs, through text messages, through old classmates and colleagues, I think was really important because we started out with just a conversation with a couple hospitals, and all of a sudden it really grew. Sorry, Darren, I don't know if you want to talk more about that. I think we even did some drop-offs at some different reservations around the New York City area and beyond, right, the Rikers Hospital.
I'm going to talk over my echo and hope for the best here. But no, so we donated to reservations in South Dakota and Nebraska. It was the Sisterton Nation and the Omaha Nation, which was that was a really important moment, I think, for the team, because I think like this kind of took us even just outside of like our like general periphery and like, you know, like New York City, I don't know, it was very crazy to like see like how many people were being, you know, kind of like bottom of the bucket priority. You know, like the fact that like Native American tribes were reaching out to like a little organization from Queens is just like, I don't know, it was a scary moment, I guess.
Yeah.
This is a very scary moment.
No, go for it. This is another, yeah, we had a lot of surprising moments throughout our journey, and this was definitely one of them.
So basically like one of my girlfriends messages me and she's like, hey, have you heard from Wayne yet? I was like, what? And she's like, yeah, Wayne wants to help. He's going to message you. I was like, what? Who's Wayne? Which I later found out was kind of like this very kind of like a New York fixture, I guess. If that's what we want to call him. Lovely, lovely man.
Big New York personality.
New York personality. But he ended up like, he didn't even message me. He just started making videos, and like he like tagged us in this post where he's like for everyone that donates like such and such amount of money, I'll leave you like a 5-minute video or a 10-minute video or customize this or customize that. So he ended up just like really owning this random project that came out of nowhere. And like he really helped us raise a lot of money. And I think that was a really beautiful moment, I think, for the team as well, because it really showed like community coming together in ways that we had never expected. Can we play? Is that a video that we can play?
Yeah, we can play that video. Hopefully the sound will work for everybody.
Making face masks and PPE and other medical professional equipment for these people. We don't want them dying. We want them to stay alive, to help us forever. They're great people.
There you go.
So for those that don't know, Wayne Diamond is an actor and a New York personality, but he was one of the actors in Uncut Gems, which is a movie by the Safdie brothers that everyone should see if they haven't seen it. So even though we were doing as much as we could and we were taking our mission very seriously about delivering as much PPE as possible to hospitals and healthcare facilities, at the end of the day, all of us on the team had come from design and creative backgrounds. So it was really important to us to like add levity in places where we could, especially since the day-to-day of trying to distribute PPE at the height of the pandemic was quite a heavy experience. So there were moments where, for example, when Dara was delivering boxes, she would write handwritten notes on all of the boxes of PPE so that the healthcare workers knew where they could get more, writing thank you notes to the healthcare workers as well in the delivery boxes. And then when we had the opportunity to start making baby shields, because Wayne Diamond, who you had seen in the previous slide, was having a grandchild, and his daughter Jamie Diamond had asked if we could provide baby shields, we decided to custom make a baby shield for baby Diamond that said Diamond on the top, which was cute. So when we got to the point where we were making baby face shields, which was a number of weeks after the launch, we had already began partnering with maker spaces to scale the production of the adult face shields. So we had a bunch of volunteers that had reached out to us via social media or through friends of friends that had 3D printers at home. Many of them were designers or were working in maker spaces that had the ability to bring the 3D printers home. So for all of the volunteers that were printing at home, we decided to give them the responsibility of printing the baby shields, which was designed by somebody on our team, Lily Soretta, who is a jewelry designer at Tory Burch. So basically, when we wanted to make the baby face shields, Lily put together this design on like a 3D design on AutoCAD, and then we just ran through with it with at-home volunteers. And all of the newborn face shields are the design is open source, so you can actually access the design online, and anybody can access it. Anybody can print it using any 3D printer in case anybody wants to make a baby face shield for a friend. So I guess something that we can go into next is reaching out to our networks, which was a really helpful thing in order for us to gain some traction on fundraising and also in order for us to have some sort of legitimacy attached to the organization, because, you know, as we mentioned, this was a very sort of grassroots DIY campaign. So, you know, we were raising money on Venmo. Many of the initial donations were made through friends that we had asked for donations from through like Instagram or just through text. A friend of mine I have a friend that's a writer at Vogue, and she had replied to one of my stories and was really excited about the fact that we had raised so much money in a short period of time. Within the first 24 hours of launching the campaign, we had reached our initial goal of $5,000. So she was really impressed by that, asked me a bunch of questions, and then the next day she had cleared with her editor to write a feature about New York Calling, which was really great for us because it sort of attached some sort of legitimacy to what we were doing. And it also brought a bit more attention to us in terms of like fundraising and giving us more resources to print more face shields and get more face shields delivered to hospitals faster. Gabby, do you want to speak to the New York Times article?
Yeah, I can do this one. And I want to leave some time for questions, so I'll go through this a little bit more quickly, but we will have a leave behind deck, which has all of our notes in there and some links. You guys can definitely dive in deeper if you want. But in a similar vein to what Catherine just said with Vogue, we had one of our other founders on our team, Katie. She had a connection at the New York Times. And when they had seen what we were doing, because again, social media was really big for us in terms of getting the word out, they realized that there was a partnership that they were trying to do with PayPal and the New York Times, and they wanted to up-level different stories about generosity and kindness. And so they actually featured New York Calling, matched the amount of donations we had thus far. So we ended up getting a $15,000 donation from PayPal, which was really incredible because it allowed us to kind of continue production throughout the rest of the year without having to work so hard on fundraising. And we could actually like divert our efforts more towards printing and kind of figuring out what we wanted to do next. And then the last little bit here, obviously during the course of the health pandemic, there was another pandemic that is always going on, which is racism and the death of George Floyd and the murder of George Floyd, and just that whole movement that kind of came more into public view. And I think all of us on New York Calling felt very connected and wanted to contribute in some way, shape, or form. And so we're like, what can we do as a group? We're this really new, young grassroots org, but we still feel a responsibility to support. And so as all the protests were happening in New York, and as people were putting their health at risk by going into these mass groups of people, we decided to go out there and donate free face shields. And we also tried to circulate information as much as possible, talking to our different healthcare connections and trying to make sure that we were up-leveling information for people so that as they went to protest and wanted to get tested, that we were making sure that everyone felt safe and were able to go and exercise their rights, but also making sure that they had, well-being and health and safety within that. And so with that, I think we can just end. You've heard us talk about this throughout, but we can end with a couple key takeaways that we had as a group. There's a lot we're still learning. We're very new, obviously. But the first one is to really just put yourself out there. Like all of us are from these different backgrounds. None of us had ever started an org like this before. We didn't have a special degree in like community service or like community fundraising. We just tried it and, used whatever skills that we had, and actually having some distance from those spaces, I think allowed us to innovate and come up with ideas that perhaps haven't happened there before. The second one is being flexible and willing to pivot. I think as we started out, we were very focused on providing PPE to healthcare workers, but as you can see throughout the course of the year, we pivoted to helping in providing PPE for protesters, for people on reservations, for people at prison centers, like whatever that was. We wanted to pivot and make sure that we just were serving our community because that was what was most important to us. And then the last one is all about reaching out to your network, not being afraid to tap into whatever it is that you have. I think it can feel really nerve-wracking to be like, I have this small thing and I don't know if I should ask this person to write about us or to even just post about it. And those became such great moments where everyone is just trying to help, and you realize that everyone's goodwill is going to lead to really great places if we all band together. And we'll drop this information in the channel there in Slack. But if you guys have any other further questions after this Q&A, please feel free to hit us up. If you want to get involved, anything, please reach out. We're always welcome as we kind of think about 2021 and what we're going to do next. I guess now we can take some questions.
I think Rachel had asked a question about what we learned in the process, but I think you just covered that.
Let's see. This is a question. Since your team is across the country, has this production expanded to multiple locations outside of New York?
I Well, our production has not expanded outside of New York, but distribution, we definitely worked on distribution outside of New York as it became necessary or as we were getting requests through the pandemic. So production was always in New York. I think maybe did we have any vendors in Jersey or anything like that, Dara?
Yeah, we had some vendors, but they were mostly serving, the needs that we needed for the New York City, like metropolitan area. But we did have a few like friends and just contacts reach out to us from like LA, for example, that like wanted to replicate the same thing. So, I think they kind of went off on their own, and like maybe took our files and made some shields themselves. So, I mean, I think that was the purpose of it though, to like kind of open source our files and like share and like give others the ability to like print and, if they wanted to raise money or whatever it was, just to kind of, have that as a resource. So I think they were doing that like in LA and other, like Philadelphia did it. So yeah, there were a few other places.
I see another one here says, it's one thing to have an idea, it's a whole other to actually take that first step of action. Do you have any advice for people having a hard time taking the first step? I can lean into this a little bit as someone who comes from like the advertising creative field, and I always have deadlines and client reviews. I feel like I often rely on those things to get stuff done. I think a lot of us on this team do. And so I feel like I had a hard time looking at a blank page and being like, what in the world are we going to look like? Like, how do we look legit? How do we like make sure we show up in the way and the intention that we want? And it was really hard to start, but I think the great thing is just letting yourself free of imperfections. I think I was so used to having client, like it has to be perfect. Otherwise it's never going to go live. And I think this one, you have to put the needs of others before like your own fears. And that really drove me. I was like, this is too urgent. Like, I can't do 6 rounds on this. I have to just get something out there. And it's okay if it changes over time. It's Instagram. It's our own Squarespace website. We can make updates as we go along. And I don't know, that just like I had to repeatedly tell myself and make a little mantra because I wanted to be a perfectionist about it and tweak the yellow of the colors. But it was more so just about getting out there because speed was more important than like a polished look at the end.
I think like even as far as like the shields go, like we continually updated the shields like almost until like a few months ago, like it was a work in progress for months. Like if we got feedback from a hospital, for example, that said like, oh, the plastic is weighing down, it's a little too heavy, we found a new piece of plastic. But like, like I think everyone still really appreciated the gesture overall. So I think like that kind of like, you have to start somewhere. Like you're never going to have your perfect product like right away. I mean, if you do, then awesome for you. But like, I think it's okay to have the, the growth and like the edits on edits on edits like that's, it's part of the process.
Yeah, I think that we were really lucky also because the core team was 9 people. So we were really able to help each other like fill in the spaces that we weren't sure about and give each other feedback. So that was something that I think was a strength of ours for sure. So that I think made it a little bit easier to start because everybody was just supporting each other to like make something happen.
Yeah. Do we have time for one more question, Rachel? I think maybe yes. Okay.
Great.
Which one do we want to go for? Let's see. I think we kind of answered. Go ahead, Catherine.
Well, I think just quickly, the question that Nessa asked, would the service expand to those not in healthcare and still statistically affected more than others? We as a team have discussed like what the next iteration of our priorities will be because at some point the city did figure out how to order PPE and then hospitals were not experiencing a shortage anymore. So there was less of a need for us to deliver hospitals, or at least it was less urgent and less frequent. So the team has discussed what the next iteration would be, and health equity is definitely something that's on the agenda. The infant mask is open source. Are there other aspects of this that could become open source? Well, I think the model for the adult face shield that we initially used was the 3D Verkstan. I'm not sure if the adult mask model that we have now is open source on the website. Is it, Gabby?
I don't think it's on there publicly, but I do know that we, like to Dara's point, we have shared it with other people. We're not like
Right.
overly precious about
It
things.
was also not like our original file. So like it is searchable online. I'm not sure. Yeah, I'm not sure.
Yeah, it's the 3D Verkstan model. So the original model is the 3D Verkstan. It is open source, and we just tweaked their model.
Yeah.
Did you face any human barriers, people who opposed what you were doing, human interaction challenges? I don't think so.
Yeah, I think I'm trying to think if it's an external, internal thing. I feel like the only human barriers, which aren't even barriers, was just like learning how to work across different time zones and different, different skill sets, like between our team. I think that was really interesting and important, is just figuring out everyone's strengths and how we kind of can complement one another, and like how we use the time differences to our advantage. Because I'm West Coast time. Most people were like, East Coast, New York, Catherine's in Tunis. Like there's a whole bunch of different people and pieces moving, but I actually think that worked as a strength, and it wasn't really a barrier, just something we had to learn and then use to our advantage.
Well, I think like one like minor thing, like at the very beginning of like us trying to donate PPE to hospitals, like seeing as how like we were literally sanitizing like in our homes, like in my house in Queens, not in like a clinically approved like lab or factory. There were like, we were reaching out to the procurement teams after like friends of ours were like, we need PPE. We're reusing the same things like for days and days and days and weeks in some cases. There was like this like slight moment where like the procurement teams were like, well, where is this coming from? Oh, we actually can't accept that. So that was kind of a barrier, and we did kind of like, healthcare workers were requesting the stuff, they needed it. So it was like, we put it out there for them to do whatever they wanted with it. So in a lot of cases, like ER doctors and nurses and whoever it was, like they were just kind of accepting donations on their own. But eventually,
because the hospitals were not accepting them from us directly at the beginning.
Yeah, but eventually the hospitals were like the procurement teams that at one point said no to us were like, oh my God, we are in dire need of this. Give us whatever you have. So I guess like that was the only challenge I think that we actually faced, like as far as the barriers go.
Awesome. Well, thank you all so much. Thanks for sharing time with us, for letting us share our story, and drop any other questions you have in the Slack or email us. We'll drop that deck in there as well. Feel free to reach out. Thank you so much.
Thank you.
Thank you, guys.
Bye.
Thanks, Debbie. Thanks, Sarah.
Bye.
Yay. Oh.